March Madness is upon us, and with the tournament kicking off this weekend with Selection Sunday, fans are getting ready to create what they hope will be a perfect bracket. And while March Madness bets can be a lot of fun, you do have to be careful and really check yourself on your limits and your mental health. So joining me now for a deeper dive on some of the potential concerns, things to just be careful about, right? We've got Director of Behavioral Health at AdventHealth Porter Brad Sjostrom. Thanks for being here.
Thanks for having me.
I don't want to rain on anyone's parade. March Madness is a lot of fun. We can all have a good time.
We can.
But we got to be careful.
Yes. It's very essential to be careful. Set a limit. If you're going to gamble, say, look, I'm going to spend $100, and if I lose it, I'm done. That's the best way to go. Now, the alternative is just not gamble at all, but some people really enjoy doing
Or
it.
you can do those little $5 pools. There's a lot of very low risk, but I think you got to know yourself, right? You got to know yourself as a person.
Yes.
So I guess let me tee you up with some thoughts here on how to even proceed. You got to know yourself as a person and what your limits might be, but what is the first few things if someone's kind of playing around in this arena to be thoughtful about when it comes to betting?
I think people getting wrapped up into the moment, if they're consuming alcohol, they're at a bar, all of a sudden they can do a parlay and they think, oh, I'm having a big streak, I'm just going to bet $50, and they win, and they keep winning, but then all of a sudden they start losing, and then they get into a deficit. So not letting oneself get carried away in the moment.
It is a lot easier to bet today than it's ever been with all these little apps and these accounts. And I have friends who love it. They're like doing this like it's a social media account. It scares me to death. Like, what are you guys doing? How much money are you spending here?
Yes. And the thing, too, is these companies will give people $100, like, hey, the first 100 is on us. And it's a way to lure people in. It's like substance use. A good drug dealer will say, hey, the first hit's on me. So once someone gets hooked, sometimes people are off to the races. The interesting thing with that, too, is I've known people who've taken the 100, who've made money, who tried to cash in. They said, no, you can't cash in on our money. You have to spend X number of your own dollars. So it's some clever and subtle marketing ways to lure people in.
Interesting.
Yeah.
Can you talk a little bit about understanding that line? What goes from just fun, controlled betting to suddenly something's not in control anymore? And maybe control is not the right word, but it crosses a line into dangerous territory.
Yeah, I think control is good. When things become out of control, people have spent way more money than they intended. All of a sudden they're in debt, they're distressed, they're taking out lines of credit, they have debt collectors calling them. There is a threshold people cross, and it tends to be pretty obvious. There is a level of shame involved in it, though, because they're embarrassed. All of a sudden they're having to hit up friends and family for money, and it's not like substance use where there's outward signs of addiction. You know, if someone is drinking too much alcohol, they go through withdrawal. But if they're gambling too much, there's no withdrawal symptoms. So it can be maintained very privately, and again, there's a lot of shame.
This time of year is so fun, right? We have the March Madness tournament. Like the broader public world is fun, celebratory. But for someone like you, do you worry a lot about patients this time of year? Like these are landmines, if you will, times of year. Yeah,
we do. You know, Super Bowl, March Madness, those are the times where people can get way too deep into it.
Yeah. Just times of the year to be more thoughtful about as well. So any advice for folks as they proceed? We talked about a little bit of this already.
Setting a limit, not getting swept up in the moment, not getting carried away, not betting when they're under the influence of an intoxicating substance. If one is, inebriated, it's not good to bet then. Frankly, it's not good to do anything when one's inebriated.
That's fair. It's just generally good advice.
Generally good advice. And so, and know one's limits.
Yeah. And I think my last question is, maybe you've passed the limit. Maybe you love someone who's passed the limit. What do you do? What are the calls you're making? What are the things you should be doing to help yourself?
I mean, the first step is the person has to acknowledge they have a problem. They have to say, look, this has gone too far. I'm in over my head. I need help. But with gambling, there's debt, so there has to be some financial management, and then there's mental health treatment. Usually you start with individual counseling. A good counselor who specializes in addictions is the way to go. I mean, there's more long-term programs if there's other issues going on, but good individual counseling is a great start.
And I assume, like any other addiction treatment, you can't find a way to gamble moderately. You just need to stop. Right?
Yeah.
Like you would with any other substance
Absolutely.
abuse. There's just no way to manage if you can't manage.
Yeah, if one crosses that threshold, it's best to be abstinent.
Okay. All right. Brad Sjostrom, thanks for coming in and talking about this today. And for those of you playing around with March Madness, have fun, be careful, know your limits, right?
Yeah.
Thank you.
Yeah.